Uh, Hello, everyone. Welcome to another conversation with MHT. For those who you are new and who do not know about MHT, Mental Health Today is a website that connects Indian mental health professionals to one platform where they can directly connect with their audience. The website aims at disseminating the latest awareness of latest interventions and self-help resources in the field of mental health through articles, podcasts, and webinars developed by professionals and experts in the field. Our website URL is mentalhealthtoday.co.in. My name is Vanisha Sodi. I am an MHT intern, and I'll be the host for today's conversation. And the topic for discussion for today is depression, skills, or pills. Today, we have with us Dr. Soumyajit Sanyal. Dr. Sanyal is currently practicing as a senior resident in Geriatric Psychiatry, KGMU in Lucknow. He pursued his MD in psychiatry from the Institute of Human Behavior and Allied Sciences in Delhi. So, Dr. Sanyal, just to start the conversation, how would you explain depression in like just a few simple words for people who might not be aware of it or who have like a wrong idea, just like what they have gathered by listening to the media or here and there? How would you explain that?
The first thing that's important to understand is the difference between sadness and depression.
Yeah.
Now, sadness is one of the most common human emotions. Everybody goes through it. And actually, for over the last 20 years, because of the awareness of mental health and the mental health disorders, what has unfortunately happened is people have falsely started equating sadness with depression.
Mm-hmm.
So both of them aren't same. I mean, there is an overlap obviously between both of these terms, but both of them are entirely different things. So what we understand by depression and clinical depression is it's actually syndrome. Syndrome meaning it has various signs and symptoms, starting from fatigue, loss of interest, sleep problems, appetite problems, suicidal thoughts and ideas, and that lasts for a long time. I mean, that starts from 2 weeks, may last up to a year or maybe two in some cases. So it's important to understand there's a difference between sadness. Of course, people feel sad from time to time. If sadness is normal for 5 days, 7 days, or even 10 days, it's perfectly fine and acceptable. But once it gets more than that, and once it starts affecting your functioning in terms of you started losing days of work, you started losing your academic classes, you started having bad scores in the tests, and that is the point when we say that it may be a bit more than a normal human emotion and it's something that should be looked at. So I think that's very important to understand and appreciate the difference between sadness and depression, and it's very pertinent in today's date because more people are falsely diagnosed as depression and more people are underdiagnosed as depression. So we have people on both sides of the spectrum. So yeah, it's quite important to sort of actually correctly identify.
That's what I also feel, because it's so popular in the media that like even if someone is going through like even if they're just sad, as you mentioned, they'll say, oh, I am so depressed. And me being a psychology student, I get really offended, and I tell them that depression is a bigger thing, not to underplay sadness, but you cannot like interchange the two terms.
Yeah. And it's also very important not only to identify symptoms of depression within yourself. I mean, whether you are going through it, but it's also very important, and it's a matter of social responsibility to identify people who are going through depression among your peers or among your work cohort or your work colleagues, so that you can actually ask them or actually help them reach clinical help. So
yeah,
important in both of the cases.
Yeah, of course. So my next question is that, like, as you mentioned, that depression can also lead to like some suicide, like ideation. So just like that, just like suicide, what are the danger signs that needs absolute help when it comes to depression?
So in depression, there are two I would say danger signs. The first being obviously if a person starts expressing suicidal thoughts or ideas,
Hmm.
if he starts saying that he has an idea that he is going to end his life, he is has made plans regarding it, and he has actually uh, taken steps to start executing that plan. For example, if somebody says he is going to die by consuming pills, for example, and they have started going to the pharmacist shop and getting medication over the
Hmm.
counters, and things like that. Once the people start voicing their ideas, when they start executing their plans, what they had in mind, that is a very dangerous sign, and that is a sign that a person should definitely be taken for clinical help, and the person should get some sort of clinical attention. And another dangerous sign is when a person starts neglecting his physical health. He stops eating, stops taking his essential medications like the medications for diabetes or hypertension. If he keeps ignoring his work and keeps ignoring his personal hygiene, for example, and that is also a sign that a person is in need of urgent clinical attention and clinical help, because both of these can herald into something that's very serious. Suicide can obviously lead to a completed suicide or death,
Hmm.
and ignoring one's physical health and hygiene can also increase the proclivity of certain diseases that can also affect the person in the long run. So both of these are quite important indicators that a person should be given help or a person should be taken for help.
Okay. So, what are some of the latest interventions in the medical treatment of depression?
Well, the latest intervention, I would say that the intervention can be divided into two types. One can be like three types. One is the pharmacological, the medicines that that doctors prescribe. One is the therapy or the psychotherapy, the counseling or the talk therapy that psychologists advise. And another thing is something called as somatic therapy, which is I'll get to that a bit later. So latest pharmaceuticals are there. I mean, drugs are obviously coming down the pipeline, and there have been a few medications that have launched in recent times. Something like vortioxetine, which have a very different mechanism of action as compared to other antidepressants. And the latest that you would read in news is the ketamine, of course, that the ketamine infusion that is currently been FDA approved, and that's used for severe depression in certain cases, obviously. And in terms of somatic therapy, what I mean by somatic therapy is it's actually something called as electroconvulsive therapy,
Hmm.
that you sedate the patient and you give them electrical stimulus, they get convulsions, and that actually remits depression. And similar to that is something called as a RTMS, that's repetitive transcranial magnetic stimulation. So you put a coil of magnet with high pulse frequency over the target area of the brain, and that stimulates the brain and actually improves your mood and anxiety. So, and there's very rare cases something called as vagus nerve stimulation. So you get an electrode and you place it into a vagal nerve near your neck, and that stimulates the vagus nerve, which actually improves your mood. But these are used, somatic therapies are used in extremely rare cases. So people who suffer from depression would rarely go through something like that. The most of the people would end up receiving is either psychotherapy, which is the most common form of treatment, or in cases where they don't respond, or in the severe cases, they would receive medications or antidepressants in this case. So
Okay. So, somatic therapy, I think, is it the same one that was used like a long time back when people did not know a lot about like depression, when they used to give shocks to patients?
not really, because electroconvulsive therapy is what previously used to happen is people were not anesthetized before they were giving electroconvulsive
Oh,
therapy.
got it.
Now that has modified. So for the last 30, 40 years, people have been receiving under anesthesia. So they are completely
Mm.
anesthetized, and then they are given electrical stimulation. So that has been shown to as one of the most effective ways of of treating people who are suicidal and treating people who are not responding to antidepressant medications. So that is used in very rare cases, but on those rare cases, it's pretty effective. So
Okay.
I'll repeat again:
Yeah.
majority of the people don't receive that. Majority of the people only receive psychotherapy and either pharmaceutical drugs like antidepressants.
Okay. So, as our topic for today suggests, skills or pills, which means either one should go for therapy or one should go for drugs. So, according to you, who should go for therapy and who should be prescribed drugs when it comes to research? Because when it comes to depression, I'm sorry, because during some research, I found that antidepressants help in symptom relief. So, wouldn't that make any person with any sort of depressive symptom want to take antidepressant, just like a shortcut that why to go through the whole process of therapy when this can be done with a pill?
So regarding antidepressants, so antidepressants is quite a double-edged sword because if we talk a bit about the history, I mean, antidepressants and antipsychotic medications were one of those medications that are actually help mental health treatment in the community. Prior, what used to happen is people suffering from severe mental disorders would be taken to an asylum and they will be kept there, segregated from the society. And that used to happen as recent as 1950s and
Yeah.
60s. And after that, the advent of these drugs have enabled closing down of asylum, deinstitutionalization of the people of mental illnesses. And we can now treat people safely in community, and everybody likes that. I mean, every patients want to live with their family and nobody wants to segregate people. And regarding antidepressants, so antidepressants have provided enormous amount of benefits, obviously, to people and to mental health professionals. But it's also one of the most commonly overprescribed medications in the world,
Hmm.
along with benzodiazepines, which are a type of anti-anxiety and sleep inducers. So it's so easily available and it is such a shortcut, like you mentioned, that everybody prescribes antidepressants. Even if you don't have the symptoms of depression, you can end up receiving a prescription for antidepressants. So the prescription overuse is a very big problem. I mean, from clinical side, you don't want to give antidepressants to people who don't need the medications for depression. But what should actually be done, who should receive therapy and who should receive antidepressants, I would say there is not a clear distinction between them. The research has obviously shown that people respond better when the both of the treatment are combined. When they receive both antidepressants and psychotherapy, let's say CBT for example, people
Hmm.
do far better than people receiving either antidepressants or psychotherapy. So but there are guidelines as to who should get antidepressants and who should get psychotherapy. So what guidelines usually say that the people who have mild depression, a mild severity of depression, should be offered psychotherapy first. I mean, that's
Hmm.
without a doubt. They should be offered psychotherapy first. Second is people who have a bit more severe depression, what we call as a moderate depression. They should receive, they should have a choice. Either you can take antidepressants if you're short on time, if you do not have the facility for getting yourself in a therapy, if the therapist was not available, or you can choose between antidepressants and psychotherapy, whatever may be your preference. And in severe depression, it's usually recommended that you combine both of them for the maximum effect. So that is one of a few overly simplistic heuristics that clinicians follow. I would not say in India, but across the world. And that has proven to be quite acceptable for a lot of people.
Okay. So this question ties to my previous question that how does treatment with antidepressants improve the neurochemical imbalance caused by depression? Because we just know that you take a pill, it makes you feel a certain way, and that makes you feel better. But how does that? What's the mechanic behind it?
So most common type of antidepressant is something called an SSRI. It's a selective serotonin reuptake inhibitor. So what it does is it binds with the serotonin transporter between your neurons, the brain cells, and it increases the level of serotonin in your brain. And that increased level of serotonin, what it does is it has a post neuronal modification. So what it does is it suppresses certain receptors in the brain neuron, and that decrease in the neuronal receptor actually causes changes in the neuronal structure and their chemistry in the brain. So that is one of the putative mechanisms that have been put forward and that people have been following over the last, say, 20, 30 years since the advent of SSRI. But now the latest research show that the SSRI do not only increase the level of serotonin in the brain, but they also increases the other neurotransmitters like dopamine and norepinephrine indirectly. And they also causes change in the synaptic structure of the brain. So for example, so in brain, actually, the neurons, the brain cells are connected in a circuit-like manner. One is connected to the other and is connected to the other, and various, that's called a synaptic structure. So in depression, what happens is the synaptic structures get disturbed, and this antidepressant can help mend that, can help cause a synaptic growth in certain areas, releases some brain neurotropic factors like BDNF, which causes growth of synaptic neurons. So essentially, it increases the level of certain brain neurotransmitters, decreases your level of stress hormones in the brain, causes increase in synaptic structures, the whatever the structures that have been disturbed or got disorganized because of the depression actually corrects itself. And I think the effect that you see, that the improvement in anxiety and depression, is because of all three factors: hormonal, neurotransmitter, and the brain structure. All of them sort of improve during the course of time. And I should also tell that this doesn't happen overnight. Obviously, when you're mending the synaptic restructuring in the brain, that it will take time. Sometimes it may take up to 6 months in certain cases, but people start seeing the effect of change of serotonin in the brain fairly quickly, within about 7-14 days. So you
So
start feeling the
I'm sorry, I'm cutting you off. But so for the people who don't know what serotonin is and what serotonin does for us, can you like explain that?
Yeah, so serotonin is one of the neurotransmitters, one of the chemicals in the brain that actually enables information to transfer from one neuron to the other neuron. And serotonin, dopamine, norepinephrine, glutamate, these are the neurotransmitters in the brain, and their imbalance can cause certain psychiatric problem or psychological disturbances. Uh, this is all hypothesized. There are research supporting these ideas, but they are not 100% correct. I mean, it's not like you take serotonin reuptake inhibitors, your level of serotonin increases and you get cured of depression. That's not what happens. It just increases the information flow from one neuron to another neuron via serotonin. And that seems to help people in the long run. So we do not actually know what really happens inside the brain that leads to improvement in depression, but we have sort of some evidence to suggest that this is what happens.
Okay. So, Dr. Sanyal, as you mentioned a couple of questions ago, that medication along with therapy shows the best effect on depression in its course of improving it. So, can you elaborate more on that, like how that works, both of them together?
So it's better to do that with an example. Let's say a person who is extremely depressed, let's say
Yeah.
because he has suffered from failure in an exam, which is quite common among adolescent and young adults. Maybe he's not able to, because of his failure in exam, he's not able to get a job, he's not able to sustain himself financially. So he would constantly blame himself, thinking that, well, I'm not good enough for education, I'm not good enough to clear this exam, I'm not good enough to get a job. And this kind of thinking pattern for a longer period of time, he may end up with depression. So when we talk about combination of therapy, when a person comes to you with symptoms similar to that, you want to give them, let's say, and first you prescribe them an antidepressant. So what an antidepressant would do is it will improve mood to a certain extent. It will improve his physical activity levels. You will be more active to do certain tasks, and you will be able to have a better sleep and appetite. Now, once those what we call as biological functions, once those biological functions improve, then you can ask the person to visit a CBT therapist. So what the CBT therapist would do is the CBT therapist would target those cognitions, those thoughts, that negative thoughts he was having recurrently, the feeling of helplessness that he was not good enough. And once you target both the biological symptoms of depression and the cognitive symptoms in the form of these cognitive distortions, then this combination actually helps a person more than either targeting either of them. Certainly, with antidepressants, if you prescribe the person from long enough, it will all obviously improve the cognition. But if you target the cognition directly with a cognitive behavioral therapy, it will improve even more. So it will
Okay.
even quicker and even more rapidly, I should say.
Okay. So having been said all about antidepressants, I'm sure there are some side effects of antidepressants. So what are some common side effects that people who are taking antidepressants have?
So first, when you prescribe antidepressants, you have to tell patients, and first what patients usually complain of is something called as activating side effects of SSRI.
Okay.
So what that is when you give them the medication, the first thing they would suffer from is that increased serotonin in the brain, and the increased serotonin in the brain will cause, in some cases, rebound anxiety. So the person will end up complaining of more anxiety than he had previously, and he would also complain of abdominal discomfort, dyspepsia.
Okay.
He would complain of disturbance in sleep. uh, I mean, these are the things you are trying to solve with antidepressants, but what happens in first few days or first few weeks, it may actually worsen that. So
Hmm.
that is one of the most commonest side effects that we come across. And also antidepressants in, for example, I work in the elderly population. In elderly population, antidepressants can cause loss of potassium, sodium from the body, called as hyponatremia, which can end up having a very serious condition. So in older adults, we usually recommend they undergo testing every 3 months to check that their sodium levels are normal or not. And in the long term, when the people have taken, say, antidepressants for a year or so, people have very difficulty weaning off from antidepressants.
Hmm.
They usually end up having something called as a withdrawal effects. It presents with a very nasty symptomatology like flu-like symptoms, headache, generalized tingling sensation throughout the body, paresthesias, and everything. And that's why it's recommended that you wean off gradually from antidepressants. So I mean, there are risks, and one of the most rarest, but one of the most dangerous risks is called a serotonin syndrome. That the serotonin increases so much in your brain that it actually causes you significant neurological complications, although for shorter durations, but it can also happen. So there are common side effects, which are epigastric, abdominal discomfort, anxiety, worsening sleep, headache. There are side effects in a particular age group, like hyponatremia in elderly population, low sodium in elderly population. There are side effects when you try to wean off them, as in the withdrawal side effects, and there are very rare side effects like serotonin syndrome that can also occur. So the side effects are there, but when we prescribe the treatment, we weigh the risk and benefit.
Hmm.
So the risk of a person losing his financial year, he's not able to work, he's not able to study. I mean, that risk is far more than the risk of these side effects. So when that risk is acceptable to the patient,
Hmm.
then only we prescribe it. But after saying all these side effects, I must reiterate that antidepressants is one of the safer pharmaceuticals that we have currently in the clinical medicine. Uh, Telling people side effect is my responsibility, obviously, because I'm prescribing the drug, but I should also inform that this is one of the safest medications that we have around.
Okay. So there is a lot of talk about alternate interventions like exercise, yoga, aromatherapy, other than like just normal therapy and medicine. So what do you have to say about that?
uh, See, alternate therapies would work, but they are not a replacement of clinical
Mm.
attention or the clinical assessment, evaluation, and treatment. So, for example, if you take an example of diabetes, for example,
Yeah.
sure, diet and exercise helps. It helps a lot. But if you skip your diabetes medications or hypertensive medications and only do diet and exercise, that would surely not help. That will worsen your condition. So alternative therapies support the main clinical treatment. They improve patients' outlook, it improves patients' compliance, it improves patients' adherence to the treatment, it improves patients' mood and anxiety symptoms, but it only supplements the main line of treatment. You cannot substitute either of them. You cannot treat a case of severe depression with exercise. You cannot treat a severe case of obsessive compulsive disorder with diet. I mean, but certainly having a good diet and proper exercise will
Yeah.
also help to the main line of treatment. So it has a compound effect. It cannot replace the treatment.
So at the end of the day, the person has to either get therapy or drugs.
Yeah. So in that case also, mild cases of depression remit mostly on their own. So whatever success story you read on the internet, that I did this regime of exercises, this regime of diet that improved my depression, cases most likely they had a mild depression, but once that exceeds that mild severity and causes real life dysfunction in people's lives, then yeah, clinical attention and modern medicine certainly helps
So
more down the line.
it's important to understand that depression is kind of like a spectrum from mild to
Yes,
severe.
yes, yes, yes.
Okay. So when we cannot not talk about stigma when it comes to depression. So how would you like to address the common stigma around psychiatric treatment and medications based treatment for depression?
So when we talk about stigma, I mean, people do not disclose their psychiatric diagnosis, and obviously for good reason, that they don't
Yeah.
want to get blacklisted at the place of work,
Hmm.
be it education or in in his or her employment. So stigma mostly comes from people who suffer from a chronic disorder. Let's say a person suffering from depression, or for 1 or 2 months, he goes, takes treatment, gets all right, but joins back work. Nobody knows what happened, so there is no stigma there. But if a person who is suffering from an illness for a long period of time, say
Hmm.
1 year, 2 year, 3 year, or even longer,
Yeah.
they tend to receive much more higher stigma from the society, and the stigma that generally comes from society is in a form of the belief that the person suffering from long-standing chronic mental illnesses must have some kind of character flaw,
Yeah.
and this idea that person, he doesn't want to work, he's lazy, he has
Yeah.
always
Yeah.
been like this.
Yeah.
uh, this sort of idea stems from a lack of understanding of what mental illnesses is,
Hmm.
and and people have been trying to address that. People have been trying to come up with better work environment, better understanding, better education of colleagues and your work supervisor and everyone. But it's unfortunately, we have to say that we have to sort of accept stigma as is right now, because the targeted intervention at reducing stigma hasn't really helped much, neither in India, and I can't talk about the other parts of the world, but it hasn't helped in India at least.
Yeah.
So stigma is very much there. Stigma for chronically mentally ill, or even from mental illnesses. People suffer from the short-term mental illnesses. They don't usually disclose for the fear that, oh, he might get violent, he must be taking medicine,
Yeah.
he won't be able to work properly, we may fire that person whenever we get the chance. And so unfortunately that's there, and that needs sort of a large public health policy of educating people about how to go about this, how to address the stigma, how to educate larger population about mental illnesses. Does not mean a character flaw, it does not mean the person is lazy, it does not mean the person doesn't want to work, it does not mean that the person is finding excuses of skipping the work. And that is, I think, it's a public health policy more than a clinical scenario. And here activists and the government and the NGOs, everybody needs to really pitch in and contribute their level best at
Yeah.
reducing this problem. But unfortunately, stigma is here, and stigma seems to be it's here to stay.
Hmm. Also, another thing that I commonly see is that people are like, everything for a person who's going through depression, they say, but problem kya hai? That's a very common question, even though their life might seem okay to other people from the outside. And if they disclose that they're going to therapy or they have depression, the common question is like, but like everything seems to be fine with you. So that's another thing that people completely ignore.
Yeah. I mean, it's like a common thing. If you're feeling anxious, why you're feeling anxious? I mean, you
Yeah,
shouldn't feel
you
anxious. You
shouldn't.
shouldn't feel sad.
True.
So,
Yeah.
for the
Like
record, that
work in
doesn't help.
progress.
It actually makes it worse. Yeah. So,
Yeah. So we'll end our conversation with our last question, which is, what would you like to tell the viewers and other professionals regarding depression and treatment for depression?
what I would say is, see, depression is one of the most common mental illnesses and one of the most common illnesses that anyone can suffer from. And it's okay to seek help. It's okay to take medicine. It's okay to take psychotherapy. It's okay to sort of take some time off your education. It's okay to take some time off the place of work. And it's very important that not only you identify the symptoms of depression within yourself, but it's also your social and moral responsibility to help people who are going through depression in and around you. Because one of the most common problems in depression is that the person himself won't feel motivated enough to go and seek treatment because they are in such a bad state that they don't get the energy or the motivation to get up from the bed and go to a clinic or to a hospital or to a therapist for any kind of help. So it's a social responsibility as much as it is an individual responsibility to help people who are in need. In India, there are a lot of mental health professionals around in every city. uh, People are there. So only thing that is stopping people is their own
Hmm.
belief that they don't have mental illness, they can't suffer from mental illness, or their loved ones can't suffer from mental illness. And that is an absolutely nonsensical belief because everyone is susceptible to mental illness. The kind of environment we live in and the kind of lives we have, everyone is. And once you go through it, it's important for you not only to seek help, but it's important for you to help others to seek help as well.
Yeah, I think denial is one of the biggest things that stops people to take the first step itself, which is going
Absolutely.
and asking for help. Okay, thank you so much. That was a great session. I learned a lot. I live in Canada and I got to know a lot about what's happening in India and how people like mental health professionals like you view depression. So that was a very informative session. Thank you so much, Dr. Sanyal. And for
Thank you.
everyone, please like, share, and subscribe to MHT for more blogs, podcasts, and webinars and conversations on mental health. Thank you so much.
Thank you.